2018 was a year of firsts for Duke Health. It started with North Carolina's first organ transplant between an HIV-positive donor and recipient.
So what's unique here is that it's been a new pathway for us to be able to make transplant available to folks for whom it might have been more challenging.
When Stan was able to get an HIV-positive organ, it frees up a potential donor that he was waiting for on the regular list.
Duke Hospital is currently the only transplant center in the state with a program accepting HIV donor organs for transplant recipients, including kidneys from living donors with HIV.
Then, in October, Duke's transplant and plastic surgery teams, led by doctors Deb Sudan and Detlev Erdman, became the first in the state to perform an abdominal wall and intestinal transplant.
The surgery replaced a 37-year-old Fayetteville man's abdomen wall. It took 14 hours and 25 physicians and staff to get the job done.
You know, I know Duke is all about Duke basketball, you know, but this is, I'd rather be on this starting team right here any day.
And on Thanksgiving Day, another team, led by Dr. Linda Sandales, performed a bilateral hand transplant. It was another first for North Carolina. In July, clinical trial research from the Preston Robert Tisch Brain Tumor Center was published in the New England Journal of Medicine. The results showed promising treatment of glioblastoma.
In the first phase at Duke University, 61 patients with glioblastoma were tested with a modified poliovirus ejected into their tumor. 21% were still alive after 3 years. This is compared to 4% with chemotherapy.
The therapy is now being tested as a treatment for melanoma, and testing will soon begin for breast cancer. In another study, researchers found that unhealthy weight is the reason about 1 in 4 obese children with asthma develop the lung disease in the first place. The impacts of our modern and sedentary lifestyles didn't stop there.
On the Health Watch this evening, bedtime isn't just for kids. A new Duke University study shows for good health, adults need a regular sleep schedule too.
So researchers looked at almost 2,000 middle-aged and older adults, and they found that compared to people who went to sleep and woke up at the same time every day, people who had irregular sleep patterns, they tended to weigh more, they had higher blood pressure, they had higher blood sugar, and they were more likely to have a stroke or a heart attack within 10 years.
But there was some good news.
A healthy amount of exercise may be easier than you think, according to new research from Duke University.
Researchers tracked the health of nearly 5,000 people for 6 years, and they found it didn't seem to matter whether exercise came in a number of short bursts of about 5 to 10 minutes or longer bouts. The health benefits were similar, so really pretty exciting stuff.
Faculty also continued to receive strong support from federal funding agencies. A $20 million grant awarded to a team led by Dr. Shelley Huang at the Duke Cancer Institute will fund a national clinical trial exploring best treatments for early breast tumors. And the Duke Clinical and Translational Science Institute was awarded a 5-year grant of more than $60 million from the National Institutes of Health. The goal is to advance innovative ideas from the point of discovery to implementation in clinical practice and population health. Groundbreaking research and new surgical techniques are only one part of the story. As a testament to our continued dedication to high-quality patient care, both at the bedside and in the extracurricular activities that staff produce, the health system again achieved magnet recognition. The credential from the American Nurses Credentialing Center is the highest national honor for professional nursing practices.
You know, we've been on this journey for a very long time and have consistently over the years demonstrated excellence in our organizations.
Excellence in advancing health together, which Duke Health is poised to continue into 2019 and beyond.